talking about all of that throughout the show. But first, I want to introduce you to Dr. Tina Alster. She is a dermatologic laser surgeon, and director of the Washington Institute of Dermatologic Laser Surgery. Didn't know there was an institute in Washington, D.C.
That's right.
And she's going to tell us all about the latest developments to make your body look better. First, let's talk about Cellulite.
What do you want to talk about?
Well, there have been lots of products and creams that people say help reduce cellulite, but none have been approved by the FDA.
So, and for good reason.
Because
they don't work.
They don't work.
No, they don't work. I mean, they smell nice. They don't work. If it was that easy to rub a little bit of cream on the skin to get rid of fat, don't you think we'd all be doing that?
Ooh, baby,
we'd be taking baths every day in this stuff, right? No, they don't work.
But there is a new procedure that is approved by the FDA, I hear.
That's right. It's a procedure called endermology. I think we're going to be looking at this today.
You're going to show us what that is.
That's
is
right.
that what she's doing on the table?
Absolutely it is. This is actually pin rolling with negative pressure on the skin. She's doing very well with this. This is a painful procedure.
This is painful?
This is painful, and she's sitting there very nicely. The more fat you have, the more painful it is.
You are in pain right now?
I'm doing fine.
You're doing fine.
I like it, actually.
Did you have drugs before?
No, I
didn't. I just wonder.
Actually, this hurts a lot, and the more fat you have, the more it hurts because there's more negative pressure on the skin exerted by the rolling pin action of the handpiece.
Well, can I go look at this? Because how is this any different than, say, like those things you use to buff out shoes?
Actually,
you know, like when you stick your foot under there for the. How's this different than that?
The things that you buff out shoes with really don't hurt that much.
What is that?
This does hurt. Try it on your arm.
Okay, let me see it. And that is really doing something? What is that doing? I'd like to know.
Well, it's creating a skin fold, which is softening up the connective tissue, increasing circulation, and moving out tissue fluids, which are all the
cellulite.
The situation that is there when you have cellulite. Yes.
Okay.
Oprah, we know
that. Is it cellulite or cellulite?
Either way.
Okay.
And there's no correct way of saying that. But if you do a series of treatments, usually on the order of 14
to show your butt on
16.
TV.
That's what I was thinking.
Yeah.
We do 1 or 2 of these treatments every week.
Yeah.
People are instructed to drink a few liters of water daily. They're supposed to be maintaining their regular diet. And
should you already be down to whatever is your natural body weight?
As much as possible.
Yeah.
Now, of course, this is not going to replace other ways to lose weight, which is by reducing the caloric intake, by having even liposuction, which I believe we're going to be talking about in a little bit. But I find it to be nice for those people who are chunky monkeys. And chunky monkeys are those people who may need to lose 10 or 20 pounds, who may not be good candidates for liposuction, and need to lose a little bit of weight but can't get these pockets of cellulite.
So this is called what?
This is endermology.
Okay. The before and after photos for endermology can be pretty dramatic. Now look at these pictures on the big screen.
And these are pretty dramatic. I would say that this person was also losing some weight in the interim, but you can see that the tissue has been moved around a little bit. These before and after photographs show the cottage cheese effect before and not so much afterwards. Certainly we can't see that type of improvement just with simple diet, liposuction, or massage. So this is more than
liposuction doesn't take away cellulite?
I think that liposuction helps to reduce the fat and the overall contour, but cellulite many times is still there after liposuction.
Oh.
I know, you go through all that and you still have cottage cheese.
And you still have the little cottage cheese things. Okay. Now, when we come back, the latest in facelifts, liposuction, and breast implants. And can it be true that people are getting their private parts altered to look better? I hear it is. We'll be right back.